So my name is Rhonda Taubin. I'm a physiatrist at Intermountain Healthcare, and I'm going to discuss the benefits of an integrated telerehab approach. I work with an incredible team at Intermountain. Some of you may know at least the first one, who is Stephen Hunter. He's a physical therapist who's been quite involved with LeaRRn. He's the director of internal process control here at Intermountain. And Kevin Christensen is an occupational therapist who is our internal process control technology expert. So I have nothing to disclose. Intermountain is a not-for-profit integrated health system based in Salt Lake City. It's quite large. It's got 23 hospitals across 3 states, including Utah, Nevada, and Idaho. 2,700 beds, 185 clinics. They've got their own health insurance, which insures 750,000 members. And rehab services includes 1,400 caregivers of PT, OT, speech, audiology, and athletic trainers. And they also cover the whole spectrum from wellness to acute to inpatient rehab, home care, and outpatient as well. Just a little background of the current state. As everybody knows, telehealth has really taken off with COVID. We figured out that from 2019 to 2020, the telehealth has increased by 70,000% here at Intermountain. With the addition of the telehealth waivers from COVID, it's allowed our therapists to be able to do telehealth as well. And we've got something called ROMS data, which gives us outcomes. And I'll tell you a little bit more about that later, but we have found that the telehealth outcomes are comparable to in-person treatment. So the bottom line is the patients like it, the providers like it, and the national data shows a high satisfaction. So hopefully this is here to stay. I'm going to give you an example using total knee replacement, just because it's an easy example. But basically what I'm going to show you is sort of how we tie together our whole vision, which is to integrate several applications and make it into an integrated system in our electronic medical records in the hopes of increasing efficiencies, decreasing cost, and providing excellent outcomes. So the first application that I'm going to tell you about is called Capture Proof. And if we look here in the example with total knee, with Capture Proof, the patient can use their smartphone, and they can take a picture of their wound, for example, and we'd be able to compare it week to week. They've also got the ability to look at, a change in hue. So if it's getting more red, or if there looks like there's drainage of a certain color, we can look at that. It can measure range of motion. In this case, it would be knee range of motion. So we can look at that from week to week. And we can also do gait analysis. And it measures the symmetry of somebody's gait. So this can be really helpful. When somebody first has a knee replacement, for example, they're probably going to be hopping or, favoring one side. And so their symmetry would not be there. But then hopefully as time goes by, we would see the graph where the cadence becomes more and more symmetrical as they improve. So the patient could potentially use Capture Proof, say 2 days prior to a visit, send that information to the clinician, and I'll show you how this is all going to pull together in a little bit. The second application that we use is something called Medbridge, which you might be familiar with, but it's a way to provide, it does some education for therapists, but it's also used to provide patient education as well as online exercise videos. So again, the patient would be able to log into their Medbridge. They could see the exercises that were prescribed for them, make sure they're doing them properly. They could watch a video if they needed to, get clarification on it. And it would have, how many days a week they should be performing it, how many times a day, how many sets, how many reps, and that they would be able to get into this quite easily to see what their updated exercise program is. The third application is something called Notable. And this is one that really excites me. So on the day of the visit, or maybe the day before, the patient might be asked a few questions, such as their current medication list, their pain level, their narcotic usage, and if they, how they're doing with the home exercises. What this would do is it could generate a paragraph. So for example, it could say, so-and-so is a 85-year-old female, status post total knee replacement on a certain date. This is her current medication list. This is her current pain level, and it might have the pain level maybe from the past visit. She is currently decreasing her narcotic usage and only taking medication at nighttime, and reports that the exercises are going well and not causing any pain. So that the hope would be that we could use these applications to almost write almost the whole note. So you'd have the paragraph from Notable that would do sort of the history of present illness. And then you would bring in the information from Capture Proof. You'd be able to bring in the picture of the wound, the range of motion, and, if needed, the gait analysis. And then you'd also bring in their current exercises that they're doing. And that would all flow into a note. It could pull in the problem list, probably from your last visit, which just may or may not need to be updated. And then the only thing the clinician would have to do is then update the plan. So the hope is that this would increase efficiency and decrease caregiver burnout, which is a big problem these days. And I'll show you how this is how our vision of this will all work. We've also got something called ROMS. This will need to be pulled in as well. ROMS is a program that Stephen Hunter largely developed with some help from some other people. But with the ROMS data, we've got 3 million visits over 20 years. So we know what the expected outcomes are supposed to be. So for example, we can look at an 85-year-old woman with a knee replacement with a BMI of 40 and a history of diabetes, and we would have an expected progress for that person. So that if you look at this graph, we potentially could provide to the patient and to the therapist their actual progress versus their expected progress. And so the patient might be able to look at this and realize they're not progressing as expected, and maybe realize they haven't done their exercises every day like they were supposed to. And potentially it would be a motivator and help with engagement. But it could also help the clinician if they decide that maybe they need to change the exercise program if they're not progressing as expected. So again, that information from ROMS could also be pulled into the note with that graph to see how they're progressing. Our hope is then that we could have a sheet that would be like a follow-up or triage that could be sent to the clinician and potentially to the orthopedic surgeon in this case, and would be able to provide updates, especially if there were concerns. So in other words, if Mary Jones, there were concern from Capture Proof about a possible wound infection, she might come up in red and would be a printout for them to look at to see that there's a possible wound infection that needs to be evaluated. John Smith might have said that his pain was increasing and he was using increased pain medications. That could trigger, a phone call to make sure what's going on there. Sue Brown would be in orange because she might not be progressing as we expected. And then Juan Martinez maybe missed 3 days in a row of his home exercise program. And so that could prompt a message to just say, we've noticed you haven't done your exercises. It's going to be really important. Can you go ahead and make sure you get them in today? And then at the end, the patients that are progressing well could just be in green. The nice thing about this also, say the patient with the possible wound infection would maybe have a link that they could then just go back to the photo and Capture Proof and determine if the person needs to come in and have that evaluated further. So our dream is to pull this all together. Icentra is the EMR. It's a Cerner product. Icentra is specific to Intermountain. But the hope would be to bring all of this together into our EMR. So if we look at where we are currently, the caregiver at this point has to log into 6 different applications and then transfer data manually to 4 different times to get the information into Icentra. So for example, the caregiver has to log on to Medbridge, and then we have to transfer the data to Icentra or our EMR. The caregiver has to log on to capture proof, transfer the information into the EMR, et cetera. We'll show you how we would like this to look in the future. For the patient, it's the same. The patient, or not quite as bad, but at this point, the patient has to log into 2 different applications, and then they get an email or a text for 3 different others. So the patient logs on to Medbridge, or they log into capture proof to be able to give that data. For Notable, they would have received a text or an email that they could answer the questions. The same is true for ROMs. And then Avizia is our telehealth, our video visit platform through Amwell. So what we did was we did an actual demonstration where we did a typical 30-minute visit by a physical therapist and showed the current inefficiencies that we've got. So, the time that it took for preparation before the telehealth visit, logging into Avizia, which has gotten better, setting up the documentation during the visit, all of these things are not billable. The big one was the documentation that was required for ROMs, for that outcome data. That took 9 minutes and 10 seconds. And then direct patient care was 8 minutes, and that is billable. Documentation during the visit was 1 minute, and then the Medbridge home exercise setup and assignment was also 4 minutes, 48 seconds, and that is billable. But then documentation for Medbridge was another 2 minutes, 23 seconds, also not billable. So when we look at this, the current billable time was about 12 minutes and 48 seconds. And we realized that just making a difference with ROMs and Medbridge documentation, we could take back basically 11 minutes, 33 seconds. And if we add those together, that's 24 minutes and 21 seconds. So we basically could double the patient-facing time and decrease documentation time. So this would be a huge savings for the therapist. So just to start to pull it together, Medbridge provides the patient the personalized online home exercise program. The transfer of data is highly inefficient, is a big problem. We realized that the potential cost savings of integrating this, we could save at least 7 minutes per visit. We average 348 visits per month, which would equate to 40 hours per month of potential either revenue increase or increased time with the patient. So we started getting some of this integrated. We've now got single sign-on to the EMR for Medbridge. That just came through in January. We're still working on the EMR documentation integration and for the patient to be able to get into the exercises through MyHealth+, which is our portal. The ROMs data, so as I told you before, we've got data from over 3 million visits over 20 years. It combines the patient's outcome with documentation, demographics to improve efficiency of clinical decision-making. So in other words, we can use this information and know how many visits it would take for a patient to get well based on say, their age and BMI and other medical problems. The potential cost savings is reducing the time needed to switch between the applications. And in this case was over 9 minutes, which was huge. So again, we've made some progress. In January, we were able to email the ROMs collection form to the patient before the visit, which is going to be very helpful. And then our hope is to be able to get that outcome data directly into the EMR and be able to have the patient be able to access it through the portal as well. Capture proof, as I mentioned, will give us information about the range of motion, the gait analysis, and the wound status. And the wonderful thing about this is it really can help us to decrease the required in-person visits, which I think is going to be helpful for everybody. I mean, decrease office space potentially on the hospital side, and then for the patient, maybe only having to take an hour out of their day to be able to be seen rather than a half day or a full day, depending on where they live. Notable, as I mentioned, that's the automated collection of patient information. So being able to spend less time collecting and organizing the information and more time on billable services and interacting with the patient is huge. Decreasing documentation time is one of my major goals. It's one of the major causes for clinician burnout and turnover. And I think, we've got the ability to do it. So we just got to figure out how to get it into our system. Avizia is is what we're using. It's the Amwell product for the video visits. And that has now been integrated. So that's helped a lot. That's decreased our time that it takes to hook up, and get the patient on the video visit to get them started. So this is obviously increasing patient access and gives, additional options for how they can be seen. So in a perfect world, we want something that's easy for the patient and the caregiver to use. We would like something that's automated for the notes to decrease the caregiver burnout. We imagine also reminders. So maybe an automated message that just says, you're doing great, keep it up. Or, we had noticed that you haven't done your exercises in 2 days. We need to get on that. Would be really helpful. This system potentially could, make us much more efficient, saves money, improves productivity, but also, improves satisfaction, I think, for clinicians and patients as well. And we've shown that it improves, it has either equivalent outcomes or improved outcomes for the patient. So the future state of what we imagine this to look like. So this is how it would work. Ideally, the patient would log into the portal and be able to access all of the different applications that we just talked about. For the caregiver, they would be able to do the same. They would be able to have a single logon through the electronic medical record to all of the different applications. And this could increase time saved. We've shown at least 22 minutes, increase the productivity and billable time, and improve both the patient and caregiver satisfaction as well as engagement. So some of the possible research opportunities, I think that once we get this all going, we'd want to look and see, does this decrease cost? How much does it decrease cost? Will this increase patient engagement and possibly improve outcomes? Pretty sure this will increase efficiency. Exactly how much remains to be seen. It'll obviously increase access for patients, decrease caregiver burnout, which I think is crucial these days. And, we're hoping to promote continual learning to improve health systems deliveries.